more about it. But this is one of the things that we're focused on, our team is focused on every single day. Personal protective equipment. What is that? Well, it's gloves. It might be masks, gowns, face shields, goggles, and they're needed by our first responders. They're needed by our medical personnel. And I know in talking to first responders around the state, they fully understand that, and our commitment is to do everything we can to get them the gear that they need in a timely manner. Just to give you some perspective, over a 24-hour period, on average, 36 pairs of gloves are used to care for one patient who's in intensive care. This is why we have ordered non-essential or elective surgeries. We've ordered elective surgeries to be postponed, and we're seeing that happen across the state. We've asked dentists, we've asked veterinarians to conserve their supplies, and again, not do the surgeries unless those are absolutely necessary. This is why we're asking private business to help us in regard to this, and we're asking them in a number of different ways. We're asking them, some of them, to give us some of that equipment that they have, conserve it. We're also asking a number of these companies to be involved in either procuring it or actually making some of this equipment. And again, all this is a work in progress, and I just want to thank everyone out there. There's so many of you who are working on this, and this is something, again, that is certainly very, very important for all of us. Let me talk for a moment about our economy and where we're going, because that certainly is on everyone's mind. And let me just say that every single day I think about those of you who are unemployed. I think about the small businesses. I know from a family background and being in small businesses, I know that each day that goes by that you don't have income, each day that goes by that you can't move forward is just very, very, very tough. And I fully understand that. What we've done, we have done, as we've said, to protect lives. But I want to talk a little bit about how we come back. I want to talk a little bit about our economy. I've been asked, I was asked this morning, as well as last night, if I had any reaction to some of the president's statements yesterday. Let me just say, I think that the president and I are aligned. We want to get this over with as fast as we can. We want to get people back to work. The frustration that he has, I share that frustration. And each day that we can't move forward in that regard is a very, very frustrating thing. So I think we're all in this together, and I think we all have really the same feelings about this. The truth is that protecting people and protecting the economy are not mutually exclusive. In fact, one depends upon the other. The fact is that we save our economy by first saving lives. And we have to do it, in that order. If our hospitals are overwhelmed, if thousands of our fellow Ohioans do not get the care that they need, if many of our nurses and doctors get sick and don't get the care that they need, if they die because we do not have the facilities to protect them, That's a personal tragedy for them. It's a tragedy for all of us. And it's also not helpful at all as we look to how we rebuild this economy as we move forward. That would be truly, truly destructive of our economy. So these two things are tied together. And we've got to get them right, and we've got to do it, and we've got to do it in the right order. Let me also say that when people are dying, when people don't feel safe, this economy is not going to come back. So we have to flatten that curve. We have to do everything we can to separate ourselves from others. We have to do everything we can so that when this wave comes, and we know it's coming, it's not as big as it would have been, and that we're prepared for it. And so those are the things that we really must do. So if we're going to get our economy back, and I see it, I drive around, I see what's going on or what's not going on, but we've got to do this, and we've got to get through this. And we've got to get through it. We've got to protect as many lives as we can, and then we got to get ready to move forward. So I'm anxious for that day. That day is not yet here. Let me now turn to Dr. Acton for a few comments, and then to Jon Husted, and then we'll be ready for questions.
Hi, everyone. Good afternoon. I just want to take a moment to say a special thanks out to our entire team, my team at the Ohio Department of Health. They've been working tirelessly since probably early in January on this response, and I couldn't be more proud of them. A special shout out to my communications team out at the Emergency Operating Center. I appreciate all that you're doing. What I just saw and the governor's team put together out in this amazing commercial that's going out, it just really warms my heart, and I know it does yours. So you're just doing an outstanding job. And you know, the governor has really created an incredible team of people to help us through this response. So it's, of course, an honor to work for him and our lieutenant governor. And I just want to share with you, I feel like my role coming through this is keeping you understanding the science behind this and sharing the numbers as we have them. So let me share that we do have 564 confirmed cases. Again, my caveat, this is the tip of the iceberg. This is still behind, a little bit lagging in time from getting test results, as well as our still ramping up testing capability. But we do know for certain that we have at least 564 cases in Ohio, and now those are in 49 counties. We have age range of less than 1 year of age to 95 years of age, and I'm very sad to say that we now have 8 deaths in Ohio. We have some new statistics I'll share. 145 hospitalizations of those cases, 62 in the ICU, 25 of which are from long-term care facilities. As we've seen in other states, nursing homes, long-term care, particularly hard hit. And again, I just think we have an amazing team supporting those out on the front lines, but it really is those folks helping the people we love that are doing just such an amazing, amazing job right now. I do believe we have some data to share with you. This is the beginning. Those of you who ever had me as a professor of global public health will know that I'm a big fan of Hans Rosling, great TED Talk, one of the greatest statisticians. And we have teams of experts, of scientists from multiple universities, and we're working around the world with other folks doing modeling, some really great tech people, Innovate Ohio, as was mentioned, folks from universities all over this country. But we're learning some basic things, so I'm going to start with basics today, and we'll fill this out in the days to come. But some of our graphs will be on our website, coronavirus.ohio.gov. But what you can see is sort of a cases by county representation. Obviously, This is very, I want everyone to understand that cases are impacted by, if we could go back on that slide for a second. This is still by where we had testing the most quickly. So we really, it doesn't give maybe the fairest representation of what's happening, for instance, in Southeast Ohio. Some of that's lagging. But you can see that also our daily increase in cases that has been going on. Next slide. We're going to start following for you a little bit. You know, we are seeing some trends here. And first of all, confirmed cases in healthcare workers. Of course, everything we're all doing is to protect those on the front line. We do know of our cases, 16% have come from the healthcare sector. Our hospitalizations of our cases right now is about 25.7%. I've said all along that about 80% of us will be able to ride this out as an outpatient, but we're seeing a little bit higher number of hospitalizations of our cases. And I think we're going to see that trend around the country. And then, of course, 11% of our cases have needed the ICU. And the ICU, folks, is our focus through this. It's all about the capacity of our hospitals to treat the sickest. So those numbers we will follow in days to come. Next slide, please. This is since the day back in March 8th, I believe, when we recorded our very first case in Ohio. We've been watching our trending lines, and what this graph is saying is, you know, what we've been saying all along, you know, it's expected in countries around the world that we will be following more of what we've seen in Italy. That is certainly the case in Ohio, as in every other state. And we're also following, you can't see very well on this, I think, but New York. I mean, the latest science, Dr. Ezekiel Emanuel from the University of Pennsylvania did a great op-ed in the New York Times. But what we can really expect is that we're on a 7 to 14-day lag behind New York City. So the rest of us in the country can sort of see what's happening in the places where they had their peaks and their testing a little sooner. Again, we know we're very close by, but we're lagging in that testing ability due to supplies. Next slide. Again, guys, it's all about the curve. And so we're doing our very best to keep everything we're doing with our measures and our policy is helping minimize the impact on our hospital system. And we are definitely up the steep slope. But what's most important is to start talking, next slide, about our hospital capability. Next, please. Ohio's response is really around two major areas. One is decreasing the spread, and two, as the governor just said, much better than I can, the increasing our capacity through our emergency operations. So the stay-at-home is still everything that you can do at home. It makes a tremendous difference, and I promise you, Ohio, when we look back at what you have done, you as citizens have done, it is going to have made all the difference for us. We're doing policies to relieve the healthcare system burdens, and that was our trying to get rid of elective surgeries, getting our equipment from out in the field in. We're doing amazing things, converting anesthesia machines to ventilators. We're doing all sorts of things to increase that system, but you should know we will be having to build additional beds, just like you're seeing in places like New York. And then finally, this conserving PPE. Next slide. Bed availability in Ohio hospitals. I have a lot more on this days to come, but a couple numbers that I want us to start out with. We are at about 60% capacity in our hospitals. After our elective surgery stopping, we're about 60%. Our ICU beds in total in Ohio are around, I believe that says 3,600. The bottom line that we're learning now is it's all about ICU bed capacity. What you're going to see, and we're doing a lot of what we are seeing being done in Maryland, we're trying to keep people that can be routinely cared for, even that needed hospitalized in lesser care settings, and turning our hospitals into basically expanded ICU capability. On average, we're needing our hospitals to increase that capacity by 50%, and our hospitals are hard at work doing that. And we will be looking at things, you'll hear more in the news in the days to come, about hotels and even dorm rooms being turned into hospital units. So that is something we're having to do in Ohio, much like you're seeing happening in New York right now. Fortunately, we have a few more days to get that up and running, and we're learning from what's being done around the world and in New York. And then finally, last slide. We did distribute almost all of the PPE we have received has been put out in the field. Remember, PPE is personal protective equipment. That's what the governor talked so eloquently about, the gloves, the shields. There is a limited supply, that is the truth, and we have deployed that based in the need around counties, and you can see that by this graph. If you go to the next slide, please. Is that the last slide? We also have on our website what that entailed, what actual amounts of PPE. I think we have to realize that when we deploy PPE, we're doing it in boxes and cases, not truckloads. But the good news is that we have some really amazing researchers working on ways to reuse PPE, both here at Battelle in Ohio and also at the University of Nebraska. They're looking at UV light. So there are new guidelines coming out every day, every hour of how we can extend the use of that PPE. But I want to say to you again at home, what you're doing by stopping the spread is absolutely taking the pressure off our healthcare system, saving it for those of us who need it, you know, the unexpected emergencies that we routinely have, and most importantly, for the cases that we know to come. We know that at some point soon, in a worst case scenario, had we done nothing in Ohio, and we're doing everything the science has said to do in Ohio, but they're anticipating that there could be up to 6,000 new cases a day if we aren't all abiding by these things we're doing. And if you had 6,000 new cases a day, clearly that would quickly outpace our hospital capability. And that's why every move you're doing is making all the difference. So thank you. Thank you for following the governor's sage guidance. Honestly, I couldn't explain our situation better than he is explaining it today. So please continue to follow his guidance and his lead. Thank you.
Jon?
Well, thank you, Governor and Dr. Acton. I was thinking as we were getting ready to start today, I was talking with the governor, what we do is that every day we tell you what we know, and then we finish up and we leave here and we collect a whole new set of information, the latest information that we can get from our experts and from people across Ohio. And we use this as an opportunity to try to address the issues that people bring us. And one of the issues that certainly has arisen over the last couple days after the stay-at-home order was issued is the definition of an essential business. And we spoke with mayors and business owners and business associations over the course of the last 24 hours. And so I want to put a little more guidance for you, and really definitive guidance that we hope you will follow as we all in Ohio, I know, are trying to comply with the stay-at-home order and the essential business list, and we want to give you the best possible guidance we can to help you come to the conclusions that you need to come to. First of all, at coronavirus.ohio.gov, that's where the director's stay-at-home order is located. So you can go there and look at it. That site has already had 1.3 million hits today. At the moment that we announced this on Sunday, in 1 minute it had over 1 million hits. And so we're glad that you're using it. And we know at times it gets overwhelmed, but our systems have been working very well today at that website. So read the order, and then the attached Homeland Security directives or guidance that's included with that order. It's written in plain language, and we ask you to just follow the language and use your good judgment on interpreting what the intent is of the order. Please don't call law enforcement, don't call the local health department asking them to interpret it for you. We were talking to mayors today, and they said, look, that overwhelms our health department, that overwhelms law enforcement. It's not their job to interpret it for you. It's their job to enforce the order. It's not their jobs to interpret it for you, and if you overwhelm them, then they can't do their jobs. They can't take the thousands of calls that are interpreting it, to interpret it for you. Businesses, when you're trying to come to your good judgment based on the plain language of this order, you do not, I want to remind you, you don't need a letter, you don't need a certification or a clearance that you have to have with you to show that you're in compliance. But what you do need is to make sure that you have a rationale about how that order applies to you. If you have that question, we just ask you to read it, come to your justification, and have that justification prepared in case you get asked, because we just need you to be prepared in case you get a question from an employee, a local health department official. One of the things for the health departments that will help businesses as they're complying with this is that you need to follow those rules. Please don't create new rules for businesses to interpret. We have over 100 health departments in the state. We don't want to have a patchwork of rules that are different across that landscape. So let's remain consistent across Ohio on how we're enforcing the rules and asking people to comply. So once again, I want to emphasize, read the plain language of the order. If you don't qualify, then consider yourself closed. But if you do qualify, as I mentioned earlier, be prepared to explain it to your employees, to law enforcement or a health department official if you're asked, because that will come. If you're somebody that is, clearly not qualifying under this order, you will eventually be called on it by an employee, by a competitor, by a neighbor. Somebody will call you on it. So please, please, please don't force it to come to that. Just simply comply with the order in its plain language as we ask you to do. A reminder that even if you are an essential business and you're allowed to remain open under item 18 of this, there are safety and health standards you still must comply with to make sure that you're providing a safe place for your businesses to operate in a safe environment for your employees. The last thing any responsible business would want to do is to have a violation that allows an employee to become sick and then spreads that through your workforce. Governor delineated, we know that it's tough on business, but if you really want to do something that's tough on business and irresponsible, then if something like that were to happen, you would decimate your entire workforce. You would be counterproductive, that you would be spreading. So know that you have to comply with the safe workplace components of this order. And I just ask, remember what the goal is for all of this. The goal is all of us to collectively work to slow the spread. That is so very important. And if you can stay home, as has been emphasized, or you can work from home, do that. The virus only spreads when we spread it. It only spreads, as Dr. Acton and I talk a lot, it only spreads when we allow that to happen through our behaviors. And I've never recall a day where literally everybody can either be part of the solution or part of the problem. And we just ask you to interpret these rules, the stay-at-home order, the essential business, with that spirit, that we want you to be part of the solution, not part of the problem. I also want to add that as we do this and we say this, there are still businesses out there that are essential, and they need their employees to be able to come to work to help with this. They're being responsible, they're doing the right thing, but everybody from food delivery to grocery stores and the like, they're calling every day telling us how difficult it is to have the workforce that they need to serve you. And so if you're in a position where you can work at one of those businesses they're hiring, please make yourself available to do so. One of the things that, as a former legislator, I recall in going through 9/11 and going through the financial crisis is that you're being asked, and right now the governor has a great list of things that he's asking the legislature to do. We want you to know that we appreciate the way all of you are pulling together to help support us. The Speaker, the Senate President, the minority leaders, and the members We really appreciate the cooperative spirit that you're displaying as we're going through this. I know that sometimes you're at an information deficit that you're not accustomed to, and I remember that frustration myself. We're doing our best to get you the information you need, and we've been so impressed over the last 24 hours how you're pulling together to help us do that, and that's critically important, and thank you. Another question that we have received, Governor, and I know we both received this a lot over the last few days regarding lending and the financial services. First of all, the banks want me to remind you, and the credit unions and everybody who's part of the financial services industry, they're open. They're open and doing business. Maybe their lobby isn't physically open over the social distancing component, but they have ATMs and drive-ups and other types of online services where they can assist you. On mortgages, let me remind that the Federal Home Finance Authority has provided a 6-month or a 60-day moratorium on foreclosures and 12 months of forbearance to help people with home mortgages get through this difficult time. Also on this, we've had questions about commercial lenders, okay? Every state's different on what we're allowed to do. Most of this is regulated at the federal level, but I've received assurances from the banks and the credit unions. If you're a business owner who's experiencing difficulty, please call them. They have been granted authority under their charters to be able to work with you at solving those problems. The commercial lenders want to help you solve those problems, so please use the resources that they have. Talk with them to help align your finances and their terms in a way that can help you get through this difficult period. And a reminder, one final time, coronavirus.ohio.gov/business help. There's a whole list of information right there that can give you guidance on where you need to go. And then finally, we talk about being transparent up here. And one of the things that really troubled me yesterday was the fact that we received an order from the Department of Labor not to release the daily unemployment numbers. But while we will not be able to give them daily, we are going to give them weekly. So every Thursday, we are allowed to share that data, and we're going to share that data with you every Thursday as soon as we're allowed to do it. So we'll be providing weekly, not daily updates to that. And also the unemployment.ohio.gov website is up and running. We haven't had any issues today as far as I am aware of slowdowns, and we appreciate the tech teams on all of these tech solutions supporting to make sure that the services are available to all of you out there who need them. So thank you, Governor.
Thank you. Giamatti.
Thank you, Governor. A question about the stay-at-home order. What's your sense of the compliance rate? Have you heard or seen any violations across the state? And if so, what's it going to take to bring more people into compliance? And I'm talking about businesses here.
Well, Jim, I think the compliance rate is pretty good. Again, it's only been in effect for a short period of time. We'll see. We're getting reports from around the state. As John said, we talked to a number of mayors about it today. Cranley described in Cincinnati, he thought the compliance was good. So it's a work in progress, and we're going to see where we are.
Good afternoon, Laura Bischoff, Dayton Daily News. I guess this is for Dr. Acton. I was wondering if you could provide some more details on the hospital bed capacity. The 60%, is that the 40% empty? Is that enough or not enough? When will hotels and dorm rooms be used? Who goes to the dorm and hotel room? Are we going to see the construction of quick tent hospitals, kind of like we did in Wuhan, or just some more details would be really helpful. Thanks.
I know it would, and we're going to be sharing that more. We have a whole team putting together that in a way that I can give you more detail in the day to come. But I think everyone should understand and not be surprised that this is the trend. I mean, we will need to build extra capacity. Our hospitals have been collaborating to work on that alongside the governor's team. They're putting together a whole strategy. I'm also talking to other states right now. Unfortunately, I think you're probably watching Governor Cuomo, and they're using tents. They didn't have as much time to maybe use other structures. I'm very interested in using existing structures that we have and deploying some of that. So please stay tuned. I promise to give you more of that once we have finalized those plans. And of course, we stand ready to use all options.
Laura, we clearly do not have enough capacity as it exists today. That shouldn't surprise anyone. But we are out, as Dr. Acton said, looking for other facilities. Our first preference, obviously, is facilities that already exist, buildings that already exist. And it is, as she said, a work in progress. But we feel that we're on track and moving forward. Again, a lot of this does go back to the modeling. Modeling changes every day, but it is giving us a pretty good indication of where we need to go.
Kevin Landers, WBNS 10 TV. Good afternoon, Governor. This is a question for Dr. Acton. Pharmacists have been encountering patients on a daily basis that are exhibiting flu-like and coronavirus-like symptoms. Given the strain on hospitals, doctors, and urgent care, pharmacists have expressed a desire for more concrete guidance on what to do. Could you please speak to them? Thank you.
Thank you so much. I need a little more clarification on that question of guidance from pharmacists, but we will reach out and talk to them more directly. I've heard, at least in a little bit of ear to the ground, I know there have been issues there are minute clinics and other things that are in pharmacies, while there are also stores and grocery shopping going on. So I've heard there's a need for some guidance in that area, as well as, we've been giving guidance to pharmacists about how to best use the resources they have in terms of the drug supply. We talked a lot about the antimalarials, as well as giving guidance. Most patients should be talking to their primary care provider, whatever that is, and sometimes that is a minute clinic for some folks, but we want to do it by phone whenever possible, using phone or using telemedicine, going through those symptoms, seeing if they're needed to be tested and giving guidance from there. But most people will stay at home and often be a presumptive diagnosis. I want to say one more thing about symptoms to folks out there. We talk a lot about what to look for being flu-like. Some of the data we're looking at now is showing that it is things we've talked about, the fever, headache, body aches, but we're seeing some new symptoms emerge, both here in the United States. Really great data that's been coming out of Cuyahoga, talking about people talking about GI upset, just feeling more fatigued than usual, and sometimes not showing that fever, but when you're not feeling well. My best advice to everyone is, if you don't feel well in any way, stay home and make that call. And we do have also, our local health departments have resources out there. There are folks who don't have a physician. We have our federally qualified health centers to call, and we also, then you can call an emergency room, but call first. That helps them get ready to best treat you. Thank you.
Hi, Andrew Welsh-Huggins with the Associated Press. For the governor, I wanted to go back to your comments earlier about you and the president. This morning at 10:10 a.m., Governor, you sent a tweet that said, "By staying home, we can all help protect our essential workers, doctors, nurses, first responders, truck drivers, grocery store employees, etc. Please do the right thing." At 10:16 a.m., the president tweeted, "Our people want to return to work. They will practice social distancing and all else, and seniors will be watched over protectively and lovingly. We can do two things together." We just heard you, Dr. Acton, and Lieutenant Governor again talk about the importance of obeying your stay-at-home order. So respectfully, it does not sound like you and the president are aligned at all. Where Ohioans are concerned, it actually sounds like these are diametrically opposed messages. Could you address that, please?
Sure. Maybe the lesson for me is not to tweet. But look, I don't think those are inconsistent. The health and, first of all, as I said, I understand the frustration. I understand the frustration not just that the president has, but that my fellow Ohioans, our fellow Americans have about wanting this to get over and to get back to normal and to get people to work. I fully understand that. The health of well-being of every Ohioan, I believe, is really tied to our economy. We know when bad economic times go on for a while, we have bad health consequences. So those are related. You can't separate the two. But each proactive step that we take to protect Ohioans from contracting the coronavirus is also a proactive step towards protecting our economy from crashing. So they're not inconsistent. The short-term consequences of slowing this economy down, which is what we're certainly seeing, will far outweigh the long-term economic meltdown from a deadly virus that is left unchecked. We cannot leave this unchecked. We are at war with a real enemy. When you're at war, you do everything you can to defeat the enemy, and you have to prioritize that. And that's what we're doing. That's what we're doing nationally. That's what Ohio is doing. The science clearly indicates that we are on the right path. With all our collaborative efforts, our collective efforts of distancing, stay home, et cetera. These are the measures that will get us back to work. These are the measures that will help protect our economy. I've referenced several times before the lessons of St. Louis and the lessons of Philadelphia in the 1918 pandemic, 102 years ago. We've got to slow the spread. We've got to flatten the curve, as we have said, so that our hospital system is not overwhelmed. A overwhelmed hospital system, which would leave Ohioans dying needlessly, will have long-term ramifications, not just in the lives of those who died, not just in the lives of their families, but it'll have long-term ramifications in regard to our ability to recover and move forward. Leaving our hospital system, our healthcare system in shambles is not the way to grow our economy. So we have to do what we have to do now, but our goal is all of us have the same goal, and that is save lives and do what we can do now so that we can get out of this as quick as we can, so that we can get people back to work, so we can get on with our lives. So I don't think those are not mutually exclusive. Those are consistent with each other. We have to do what we have to do, and that's what we're going to do.
Thanks, Governor.
This is Jackie Borchert from the Cincinnati Enquirer. I'm just going to follow up on Andrew's question. The president has said he would like to see the economy up and running in 2 weeks, Easter. Given what you've just said, Ohio's strategy of building capacity and stopping the spread, is 2 weeks enough time to accomplish that?
Look, I would like to see the economy up and running in 2 weeks, too. I would like to see it up and running, as soon as we can. I think what we will all want is the same thing. I, as governor, have to look at Ohio. I have to take all the data I have in regard to Ohio. I have to look at where we are in Ohio at this point in the progress of this insidious invader that has invaded us, and make decisions based upon the best medical evidence that I can get. As I said, I spent a long time on the phone with the folks at the Cleveland Clinic. I'm talking later with folks from UC, from Ohio State. I mean, we're pulling in the best experts that we can, and that's my obligation as the governor of the state of Ohio, is to do everything that we can to save lives, do everything that we can to prepare us. I talked about this at the beginning, prepare us for a wave that we know is coming, and do everything that we can to reduce that wave so that our healthcare system is not overwhelmed and that we can not leave it in shambles, we can save lives, and we can get moving forward in regard to our economy. So that's my obligation for Ohio. I was on the phone the other night with governors from all over the country. Each one is in a different stage. Each one has got a different state with a different situation. And I respect all of them. I've got to make the decisions for Ohio, but I'm not making it in a vacuum. I'm making it with the best medical evidence that I can get. But again, the ultimate objective is the same. These are not they're not inconsistent. They're not mutually exclusive. Save lives, get our economy moving. We're doing what we have to do both.
But based on what the experts are telling you, is 2 weeks, is that a feasible amount of time to build this capacity and stop the spread?
Well, I think you've listened to me, about this before, and again, what we've looked at what's been projected, and we're still projecting as best we can that we peak maybe around May 1. That's again subject constantly to change, and so again, you call it like you see it every single day. And what I've tried to do with the people of the state of Ohio is to tell them everything we know, and again, that's based upon the facts that we are getting, and again, it's focused on the state of Ohio. So I would love to be rolling today. I'd love to be rolling in 2 weeks. We're just going to have to see where we are. But look, we're planning that this probably is not going to peak out in Ohio, as I said, until that's very roughly around May 1. We've got to do certain things, and the people of the state of Ohio are doing those. We're distancing from each other, and I just thank everybody for doing that. We'll get through this, but we know ultimately we got to get back. We got to get back to work, but we got to get through this first.
Thanks.
Jim Province with the Toledo Blade. I think this question is for Dr. Acton. A bill was just introduced, I believe today, that would mandate that first responders be notified even if there is a presumptive positive for coronavirus. What do you think of a mandate like that? And is this something we should be doing now anyhow?
That is still in progress, but I do have my team looking at that. Typically, as we've always said, we work very hard to protect patient confidentiality, but we have a whole team looking at the policy related to that. These are unusual times and an unprecedented situation, and we absolutely have to protect our first-line responders, and we're doing that a number of ways, including getting the right gear to them as best we can and keeping them healthy, and we're all doing that for them by staying at home and letting them know our situation before they ever walk in our house. That's also important, that we ourselves let those first responders know and our physicians and primary care people what symptoms we're having so that they can take the right precautions. Essential to do that. Thank you.
Thank you.
Hi, Jake Zuckerman from the Capital Journal. This is another for Dr. Acton. The hospitalization rate, since the Department of Health has been putting it out, is about 25% of the total infected rate, and it's stayed there pretty reliably. Is that an accurate picture of this virus in Ohio, or 25% of people who get it, or is that a product of narrow testing?
I think it's both, and I think anyone who looks at numbers knows we have a small set of data to work with. It's one of the reasons I rely so heavily for now on national projections and sort of modeling that's being done on general. The more data we get, the better and more accurate we will become at modeling specific to Ohio. But every indication is we're following the same trends that we're seeing around the world. And this data, there will be a time where we have all the testing we need. And we are already hard at work doing the models about how we get out of this the quickest so that we do balance all the health needs and do it responsibly with the very other consequences we're dealing with relative to the economy and just all these unintended cascading consequences. So there are scientists hard at work at that as well. And as second that we can test more, you're going to see a leap in our understanding of what we can project.
So is there a better estimation of the hospitalization rate right now?
I think that hospitalization rate is good enough for me to know that we're on the same trajectory as we've seen worldwide, and that we need to start preparing that hospital capacity now, and that's exactly what we're doing.
Adrienne Robbins, NBC4, and my question is for the Lieutenant Governor. We talked today again about holding back some of those unemployment numbers because of the Trump administration. A lot of that has to do with obviously keeping the markets from falling even more, but how important is it, or is it ethical to keep information from the citizens just to protect the economy? And could that come up with more information down the road with this pandemic?
I will tell you that when we had this dialogue between the media and myself yesterday, I was very frustrated with the fact that that's the guidance that we had received. I believe that we should be allowed to release it on a daily basis, but that's what they asked for. And look, we have to collaborate. We have to work together. We expect local governments to work with us. We have to work with the federal government. I respect their strategy for releasing the information. We'll do it weekly versus daily. And you know, that's really a better gauge of where we're going to be anyway, because it's, you know, doing it week by week gives you the whole picture of where things are headed. But you know, we're just doing our best to get along with everybody in the process. We will be as transparent with this. You will get this data on a state basis as soon as we're allowed to release it.
Thank you.
Hi, everyone. Andy Chow with Ohio Public Radio and Television State House News Bureau. When it comes to the order and the question of if a business is essential or not, we've heard from the governor and lieutenant governor sort of talking about the side of employers and businesses. But what about the employees who maybe insist that their business is not essential and they want to stay at home, or they believe that they don't need to go to work? What kind of empowerment do the employees have in this kind of situation?
Well, the employees certainly have the right to make that known to us, make that known to their local health department. They also have every right, if they're working and they don't think that the orders in regard to how an employee protects the employee, how the employer protects the employee are being followed, they have, I would suggest, they first talk to the employer. But if they're not getting that satisfaction and think that these rules are being violated to their detriment, their health detriment, they have every right to contact us about that.
Is there some sort of system where they can do that anonymously? We're hearing that people are afraid to lose their jobs if they do speak out.
Well, they can certainly do that. You know, I'll go back to my experience as a prosecutor. You're always better, you know, having better information. But what, you know, if we get that information, you know, we certainly have the ability to act on this. Again, the goal is to get people to do what's right. And so, you know, if we came upon a situation like that, our first step would be to notify the company, you know, and ascertain whether we thought that they were in fact violating the rules. If we decide that they are, we would certainly ask them to change. If they don't change, then we would follow up from there with the legal consequences. But again, you know, this is something that we hope people will do. I think the vast majority of people are doing it. I want to thank them for doing it. I want to thank the employers who have, you know, done a lot of different things to make their employees not only feel better, but actually about being safe, but also be safe. So I want to thank them for doing that. But everybody has an obligation to follow that. Any business that is continuing on under this order has to follow that.
Thank you.
I'll share with you a couple things to give a little more tools in the toolbox for those employees. First of all, businesses, I will share with you this. If you have the responsibility under Section 18 of this order to provide a safe workplace environment for your employees. You are in violation of this order if you do not do that. The vast majority of businesses are going to do that. But if you don't, the employee can report it to the local health department, and believe me, if that happens, the local health department is going to come out and hold you accountable. They're going to investigate these kinds of things. So you need to do that. I will also, as we talk about how we come out of this, understand that even, Dr. Acton and I were talking about this earlier today, that every employer is still going to have to follow these safe standards even after we go back to work, because we're not going to be through this entirely even when we do that. So even if you're an employer who's not an essential employer, I urge you to look at that section, because you're going to have to comply with these standards at some point in time, even if you're not operating now. Now, one additional tool. If an individual is in any way feeling ill or is worried about this, an employer can order that employee home for a self-quarantine, and that employee would be eligible under our rules for unemployment compensation. So we don't want any sick people in work. We've built a safety mechanism in our unemployment compensation system for those employers who are supposed to do the responsible thing by their employees.
Thank you.
Hi, Molly Martinez, Spectrum News. This is a viewer question for the Lieutenant Governor. Why are collection agencies considered essential right now?
Well, a collection agency, I'm trying to understand, what that would exactly mean.
Businesses that issue bond related to financial institutions selling financial products, consumer lenders, payday lenders, appraisers.
Well, I can tell you in some of those circumstances, that may be the only resource an individual has for cash or any resources to maintain their lives. But I don't want to, look, one of the things we've really tried to avoid is to look at the plain language of this order, and if it applies to you, then you can remain open. But if you're not covered under this, then consider yourself as somebody who's not essential and who shouldn't be open. And if a customer or an employee or anybody believes that this business is in violation of the rules, then they should report that to their local health department. That's why I asked earlier on, don't call law enforcement or the health department for interpretation of the rules. You're supposed to interpret the rules. But if there is a violation of those rules, that's where you can contact the health department and local law enforcement for the enforcement of those standards.
Thank you.
Hello, Governor. Paul Teasley, Hannah News Service. I hope your family and those of your administration are well and stay well.
Thank you.
You may have already answered this question sometime or another, but since Sunday, I haven't heard it if you have. But the question is, why is the state liquor operation and the consumption of hard liquor generally considered essential when many other businesses and services that individuals may consider really important to their activities are not considered essential? And I'll just add, I think I read that Pennsylvania, which is one of the most regulated liquor and wine beer states in the country, has shut down their operations.
Well, as you know, the only thing that's basically allowed is a carryout of many different products. We certainly shut the bars down. We shut the bars down. We shut the restaurants down, but we are allowing carryout. So those are certainly things that we have done in that area. John, you worked on that.
No, look, when you leave the food supply chain open, it's hard to go in and just pick things, cherry pick things. I imagine that if my wife were making the decision, there'd be a long list of things at the grocery store that she would want banned that I couldn't buy. And it just is very difficult for us to be able to make those determinations. And so what we've done is we've left the entire food supply chain open. All of these stores are usually within, or usually most of them are within grocery stores, and it's, that's part of the determination.
Thank you.
Good afternoon. Randy Ludlow with the Columbus Dispatch. A question for Dr. Acton, if I may.
Hi, Randy. I know it takes a while, the sweeping camera.
Good afternoon, Doctor.
Thank you.
Yesterday, you stated you knew of additional deaths that were not in that day's total. Is that hold true today?
I've been so busy today, I've not talked to the people on the front lines, but what I've noticed is happening, Randy, is that sometimes that data comes right before or after too. It's happening at the local level. So through all of this, I think it's really important that the media reach out. The local health departments will have the most information in the quickest time frame. They actually enter it into something called the ODRS, Ohio Disease Reporting System. That goes to our epidemiologists at the state level. It's the same way we also have to get all the testing out from the hospitals who are doing testing. There's a lag time in just the reporting from the front lines. They're so busy right now. It really is an overwhelming time there where they're focused mostly on helping the people who are most sick. So that gets in our data system. It gets to us, and we still have to clear it. Sometimes there's duplicates. And that process just keeps that flow of information a little slower than what the media is actually able to get out on the front lines. So I would assume that the deaths are going to slightly lag what you might hear at the local level.
Okay, one more. Franklin County saw its cases drop by increased by 31 or 70% today. That's a rather dramatic increase in a heavily populated area. Yes. How concerning is that?
I suspect we're going to see a continued upslope, and my guess, and I haven't had the chance to talk to the health commissioner, Joe Mazzola, just amazing colleagues I have, but if they have been able to ramp up some testing in the area, or some tests were in LabCorp or Quest, and we're taking 5 to 6 days to come back, my guess is we could be getting some batch data back from the private sector that then drives those numbers up. So it's just, we are going to have to, when I showed those graphs earlier, we're going to do trend lines, and you're going to see numbers go above and below, but what I'm looking for is that slope. Remember our slope, even on our curve where we're flattening it, if you really look closely at the granular level, it's a bunch of dots all over, but I'm looking for that trend because this data is going to continue to lag. It's not exactly real time, and the results are coming from so many sectors. So I suspect, we know that the spread is doubling every 6 days. In New York, I've heard they say it's every 3 days. As we learned and as this information comes to us, we're going to turn it around as quickly as we can to make sense of it, to help guide our decisions. But, I can say to everyone, we are doing the right things. I am absolutely convinced with every bone in my body that this governor has charted the best course for Ohio, and we just have to keep following that lead, and then we'll keep evolving it as we gather more data.
Thank you.
Thank you.
Hi, Luann Stoya, ABC6, Fox 28, Columbus. I'm going to deal with a couple of economic questions that our viewers have had. One would be, are you planning to keep the airports open to passenger traffic? That's one. Any plans to extend Ohio's tax filing deadline? And 3, any relief for business owners, small business owners who maybe can't afford to just take a loan, that they need like unemployment compensation or something like that to get through this time because they had to shut their businesses down?
Sure, I'll take the first one on airports. Look, we normally look at the airports from the national point of view. That's usually a national decision. I've been very clear. I don't think passengers should be flying. We need freight. We have to have freight coming in. A lot of things come in by plane. Many things that come in regard to medical supplies. So we would not want to see freight, those planes banned. But I don't think anybody should be flying today. It just seems to me to be a too dangerous situation. John, you want to?
Yeah, thanks, Governor. To your question, first of all, on taxes, that will be the conformity to what's happening at the federal level will be one of the things that we ask the legislature for the authority to do. So that will be in the legislative package that they're considering. And then as far as additional business assistance, we have the SBA disaster loan assistance, which is on the business help page of coronavirus, of the coronavirus.ohio.gov website. I understand that there are some businesses may be independently operating as 1099 businesses. I was on the phone with Congressman Stivers today and talking with our Vice President Pence yesterday and our entire congressional delegation about the federal government giving both the authority and the resources to be used for that, because understand how employment compensation works. Nobody paid into that insurance program under those criteria. So if you didn't pay in, you can't take out. So the federal government would have to infuse the money into that system that would be necessary to support those employees, those businesses. We're asking them to do that.
Any talk about doing that?
It is right now being considered as part of the federal relief package, the third phase of it. And I know that I talked with Senator Portman about it. I know he's advocating for it. We're trying to get this done. And I thank the legislature. I talked to Congressman Tim Ryan last night. We're talking to Democrats, Republicans. Everybody is really supportive of what we need from them. So I thank our congressional delegation, Republicans and Democrats.
I'm told that I was the last question, so I just want to say we appreciate you all. Thank you.
Thank you very much. You know, one of the things that I've really appreciated is the number of you who have said that you're praying for us, you're praying for Ohio, you're praying for this country. And I thought I would conclude with a portion of President Franklin D. Roosevelt's June 6, 1944 D-Day prayer. O Lord, give us faith. Give us faith in Thee, faith in each other, and faith in our united crusade. Let not the keenness of our spirit ever be dulled. Let not the impacts of temporary events deter us in our unconquerable purpose. With Thy blessing, we shall prevail over the unholy forces of our enemy. May that be our prayer as well. Thank you all very much. We will see you again tomorrow at 2 o'clock. Thank you.
We now join our regularly scheduled program, already in progress.
You can't even celebrate that. So let me just ask you a straight-up question, because we have to stay really tight here. As a mother, do you feel really helpless that you can't help her here?
Yeah, I mean, this was her year, and it was all about her these past next few months. And now we're quarantined, and there is no special anything, you know. There's no pictures, no gatherings, no nothing. Yeah. And it's just kind of empty, and I don't know how to make her still feel super special, as if it was still her time to shine. Does that make sense?
It does. And let me weigh in here if I can, because let me tell you what's special. What's special is your daughter being safe and healthy. And that's your primary job as a parent, is to come out of the other end of this tunnel with her being safe and healthy and you being safe and healthy. That's what's really special. And these memories that you're talking about, do everything you can to create those experiences, because this is going to come to an end. This is going to peak, and we're going to come out the other side of this. And a lot of these things are going to be post-dated. You're going to have to say, all right, you know what, we're going to get this class together and we're going to have that dance. We're going to get this class together and we're going to have that graduation. We're going to do some things that are later than we planned, but we are going to have those experiences. But in the meantime, put that dress on, take those pictures, create those memories that will mean something 20 years from now, and it will be the most memorable time of any prom ever because it was under quarantine. Nobody else will be able to say that. You know, recognize what you do have instead of what you don't have. And honestly, this isn't forever. It will come, it feels like forever, but it will come to an end. And if these kids want it, they will get together and create those things once we get the all clear. Just know that it's going to come to an end, but honestly, put those things together and take those pictures, celebrate those things, use technology. All of you get together where you're all on the screen at one time and have fun. And I know you can do that, so I'm going to really want to hear. Send me a picture, will you?
Yes, thank you, Dr.
All right, well, thank you, Hillary and Caitlin. All right, next, a mom who has 4 kids all locked down under one roof. She says she's about to lose her mind. We're going to meet her after the break. Closed captioning provided by
Fred would do anything for his daughter, even being the back half of a unicorn. Fortunately, the front half washed the shirt with Gain. Ah, the irresistible scent of Gain.